landing on the finishing point around collateral harms from lockdowns leads us nicely into our next session, where we ask, has the global response to COVID-19 caused more harm than good? And this is the first of our panel sessions today, where we're delighted to be joined by three esteemed guests to help us evaluate these big questions. Now, the lockdowns in 2020 and 2021 have arguably been the biggest interventions in the way that we work, educate, care for, socialize, and live. It's had a tremendous impact on all of us at every level within society. Now, looking back over the past 16 months, it's time to examine the collateral harm from these measures and assess whether lockdowns and heavy restrictions are a sustainable form of intervention in the future. We are joined by Professor KAROL SIKORA at our end of the panel here, who's been described as a leading authority on cancer. He's seconded to be the director of the World Health Organization Cancer Program in year 2000, and he's the chief medical officer of Rutherford Hair Cancer Centres and was founder of Cancer Partners UK, the UK's largest independent UK cancer network with private equity. During the COVID crisis, he has been a sought-after commentator in the press and in the media, advocating for more balance and for patient care. He's been dubbed as the professor, the positive professor, and has now more than 300,000 people who look to his advice on Twitter and for a balanced perspective. We're also joined by ZENOBIA STORAH, Dr. ZENOBIA STORAH, who's a senior child and adolescent clinical psychologist specializing in working with children and adolescents. She's worked in various child and adolescent mental health services settings, and in 2018 she left the NHS and now provides private therapy for children and young people. During COVID-19, ZENOBIA joined the health advisory team in the United Kingdom, supporting their work around mental health costs of lockdown in particular, and particularly for the young. She's provided media interviews and statements for journalists exploring these critical issues, and we're delighted to have her here today. We're also joined by industry captain Luke Johnson. He's a former chair of Pizza Express, the Royal Society of Arts and Channel 4, and he writes a weekly column in the Sunday Telegraph, the Financial Times, and the Sunday Times, and has done so for over 20 years. Having a degree in physiology from Oxford, he has served as the chairman of the Institute of Cancer Research for the past 8 years and co-founded Integrated Dental Holdings, helping to build it into the largest group of dental surgeries in the UK. He himself has been critical of policy throughout the pandemic and is here to share his perspectives on how the pandemic has affected wider society and the economy. And finally, I'm delighted to be joined by our panel host today, our moderator, John Dobinson. He's the campaign director of Recovery, which he co-founded in October 2020 to make the case for a less damaging response to COVID-19 with the harsh lockdowns and restrictions. He previously, as Secretary General of the International Society of Human Rights in the early 90s, understands the impact of global affairs on important issues like human rights. And prior to COVID-19, he wrote a screenplay called Vector Assassin, a film about the extremes to which people might go to avoid disease in a world where antibiotics stopped working. And even its most extreme ideas have now, in some way, been implemented over the past 12 months. So without further ado, please welcome John Dobinson to this important panel discussion.
Thank you, Dan. As Dan said, last October I founded Recovery with some of the people that are here today at www.timeforrecovery.org to make the case for a better approach to COVID-19. And that's very much the theme for today, so I'm delighted to be here questioning everything. Appropriately, my principal role is to ask some questions. And as time is short and we have excellent speakers, I will start off by doing that with a question to Professor KAROL SIKORA. How has COVID-19 and our response to it impacted cancer treatment? And why did waiting lists go up?
Yeah. So I've been a consultant on the NHS for 42 years this year. I'm really 92, by the way. And there's no doubt I've never seen anything like it. Way back in the heady days of March 2020, it was clear that something was happening. Now, amazingly, if you're a pathologist like Claire, You can't actually get data on how many biopsies are being taken every day. We know that there are 360,000 people with cancer, new patients with cancer every year, which comes roughly to 1,000 a day, 30,000 a month. And suddenly there was a fall-off in the number of biopsies from the end of March last year. And the fall-off was drastic, and it was in the private sector, it was in the public sector. It just fell right down to less than a quarter of what you'd expect. So cancer if it's not being diagnosed, it's not because it's going away. It's still coming. It's just not being recognized. And the only way you can actually diagnose cancer, other than a few relatively rare blood cancers, is by doing a biopsy, taking a piece of tissue. So what did this mean? It meant that there were going to be delays in the way in which cancer presented itself. And delays mean the stage of the cancer going from stage 1, localized to a specific organ, to stage 4, widespread disease. The cancer would go down that pathway. And the consequences are clear. Stage 1 cancer, and there are really only 4 cancers that matter epidemiologically because they make up nearly 70% of all cancer, and that's lung, breast, colon, and prostate. So I know the others are important, but they're not important for number crunching. So when you look at those cancers, stage 1 cancer, 90% chance of cure. Stage 4 cancer, less than 5%. So you gradually, as you upstage, the chances for the patient surviving, even with the best treatment in the world, goes down. So the only other thing I should say is that having worked in the NHS, it's a wonderful system, but it's totally undercapacitized compared to Europe. So when you look at the consequences in the other European countries, it's going to be fascinating as time rolls on and we can really see the lost deaths from cancer and make a comparative study, as we saw in the previous elegant talk looking at lockdowns. We can do the same to see what happened to cancer. There's no doubt we're going to see Britain is going to be more adversely infected than other countries because we know that the capacity to diagnose cancer is much less here. So a huge problem ahead for us. NHS England glibly just said everything's going to be okay. Well, it's okay unless you're dead, in which case it's not okay. So it's not.
Yeah. What were the causes behind an apparent fall in heart attacks, cancers, and strokes?
I think the 3 causes, briefly. Number 1, patients. They were scared by the very advert we saw. I think Claire put it up the slide. They didn't want to use the NHS, so they stayed at home. They were told, stay at home, protect the NHS. What a great line. Well, imagine an ice cream parlor using that message to get people to buy ice cream. It would make no sense. The NHS is there for us. It's not us for them, for goodness sake. So basically, that was one. Secondly, a lot of general practice services really collapsed completely and just gave up the ghost and didn't even try during the peak to do distant communication, virtual communication. And then 3, the diagnostic services were overwhelmed. You know, to get the diagnosis of cancer, you need to have a scan usually, and then you get a biopsy, sometimes the other way around, but a scan is important of some sort, CT, MRI, ultrasound. And they just weren't being done. And part of it were hospitals were isolating themselves from COVID. But of course, the biggest cause of patients with cancer getting COVID was being admitted to hospital, which is where they got the COVID. And they still had the cancer. So everything we heard this morning really resonates with me because the numbers were sort of, what was first, the COVID or the illness? So we saw that.
I mean, that sounds very worrying. How many lives will be lost due to delays?
You know, everyone's tried to calculate that, and the answer is we don't know at the moment. Cancer Research UK is calculated from the Institute of Cancer Research, where Luke's the chair. It's between 30,000 and 60,000. It's a very wide range, and that's because we really have to wait another 2 or 3 years before you can see how the curves for each cancer are different. But we know what they're like, and you can apply computers to sort out the data on cancer survival to work out how badly it's been affected. So I think we'll know by the beginning of next year, 2022, what it'll look like. There's already Claire Turnbull from the Institute of has produced some remarkable studies already that have been in the Lancet, but I think the end point won't be till next year when we'll be able to see it clearly.
I've argued these sorts of issues with proponents of lockdown, and what they tend to say is, look, this was an inevitable consequence of the response to COVID-19. Hospitals were full with COVID cases. It's inevitable other care was going to suffer. Is that what you see, or do you think things could have been different?
If lockdowns were effective, if the police shot people when they left their homes and that sort of lockdown, maybe if that would be, then it would be worth it. But the sort of lockdown we've had is just not worth it in terms of the fear and the operation, the psychological operation to brainwash people to avoid using hospitals. And it's not just cancer, it's heart attacks. So people had heart attacks and didn't go for immediate stenting or revascularization. They just sat with chest pain. No ambulance, no emergency room visit. And stroke, that's the other thing. These three things you can't put on ice. A lot of other things you can. It's unfortunate. A lot of people waddling around with sticks and bad hips because they've not had their hip replacement. And they're blind because their cataracts have grown over the last year. But you can live with that, sort of. It's not acceptable, really, but you can live with it. But the cancer, heart attacks, and stroke, you can't live with. You can't wait. So that's where the problem is going to be.
And the next question is, are we now coming to an end of this? My own personal fear, and I'm probably well known for this, is that I've been predicting since the start of the year that the protection of the NHS argument would be used again and again, and it's very likely, in my view, that we see it again this autumn. In fact, we can hear that already beginning. Do you think that's likely? Do you think the NHS will need protecting again? And if that is what happens, do you think that's beneficial for heart disease, cancer, and strokes, or do you think that's going to make it worse?
I think we should, my personal feeling is we should blast on, whatever the consequence. Stop looking at the data almost. There were 701 admissions on the 12th. There's always a delay of about 5 days before you get the data of hospital admissions. It was about 701. It has gone up. Chris Whitty alarms us all by saying it's going to be thousands by the end of the month. I don't think it will. I think it'll peak, but you need mathematicians to look at it closely. I like to see the curve coming down on these graphs, but it's wishful thinking most of the time. Will it get overwhelmed again? I think it might, but we can just carry on. Cancer services will carry on now. And I think diagnostic services should be able to carry on. But, the undercapacity in the system has gone back from years. I mean, the Blair government tried to change that. They tripled the budget overnight of the NHS, and that hasn't. That effect has gone. And at the moment, no one has a really good solution. So if the director of Amazon can solve it, good luck to him. That's all I can say.
But if you were advising the government now, what would be your advice?
Appoint the director of Amazon to solve or someone like that, someone that's totally different. Stop listening to all the political correctness that we have to. I do these courses on diversity and equality. I won't tell you about them. And, let's get down to getting the system working properly. And I think COVID is going to make it because we can't go on the way we're going. Something has got to give it a shock, and I think this is the shock.
Right. So you're broadly optimistic, would you say?
We've got, as a society, I think, I'm very optimistic. We can overcome COVID. It will go away, one way or the other. 10 years' time, we'll forget about it. And if we don't forget about it, we're doomed as a society. And then healthcare will be transformed, I'm sure, over the next 10 years. And, part of the problem with healthcare is its own success at allowing us to be old in a way that was unprecedented even a generation ago. So my father died when he was 56, and that was pretty close to the normal time people died. And here I am going on into old age. I mean, it's just quite amazing that it can be done. And the question, I'll finish by saying the question I always ask the medical students, I tell them, I can predict which one of you is likely to get cancer in the next 5 years. And they say, how can you? By looking at your face, I can tell you. How am I doing it? And of course, all I'm doing is looking at the age. So the older medical students have a higher cancer risk than the younger medical students. It's the same for the people in the room, but you look about 30 or 40. I mean, it's very good. And so your risk is low. So.
Yeah, the last question that I won't ask is, what's my cancer risk? That's very... But thank you. That was very, very informative. Now on to Dr. Zenobia Stora, who's obviously an expert in mental health, as Dan said. There are very worrying signs of mental health issues. I'm personally aware of some from my own experience, and I'm sure many other people in this room and listening around the world will have the same experience. Could you give me some idea of the problems that you see across all age groups?
It's fair to say that 2020 to 21 has been a pretty dreadful 18 months in terms of mental health. And I think, yes, personally and professionally, I think all of us have seen some really terrible stories. Before I tell you a little bit about the kind of statistics and the particularly vulnerable groups that have been kind of popping up as being a particular concern, I think we just need to kind of stop and think about what the government did in March 2020, because I think this has gone on so long now. It's almost become normalised, and we've completely forgotten that in mandating stay-at-home orders, in isolating the population through quarantine and these measures, keeping children out of school, outlawing even seeing other people outside your household. The government's totally disregarded, and not just in this country, but across the world, the government's totally disregarded everything we know about human beings. And we are social creatures. We're social animals. We need interaction and social contact for our health and survival. And that's always been known. I mean, that's indisputable. So it is completely extraordinary, really, what has happened in these measures. So not only have people been confined to their homes and on and off, and the measures have kind of been, tightened and then lessened, but even so, people have been, dealing with all of this. We've also been subjected to fear at the same time. So there's been huge amounts of fear messaging. And there was natural levels of fear at the beginning, wasn't there? Because we had a threat that we didn't understand. But then the government has amplified that and also extended it. So you've got this kind of combination of lockdown, isolating people, and subjecting them to fear. So I think it's pretty inevitable. I think you predict that. And I think as a mental health professional, it's been very frustrating because right from March 2020, you'd be thinking, oh my goodness, what is going to happen? We've already got a mental health crisis in this country, certainly in my field, in children and young people. We had a crisis. We couldn't meet demand as it was. And then these extraordinary measures were put in place. So yeah, it's predictable. And what's happened is, and it's been borne out, and we've been seeing this since the beginning, the middle of last year onwards, there's been research study after research study showing us that that there's been a massive increase in mental distress across the age groups, as you've said, not just in my field, but so particularly in the elderly. We've got this hugely in children and young people. It's a huge problem. Groups who are of lower socioeconomic groups, they always suffer at these times, and obviously there's lots of people who have really suffered financially, people in debt and so on. Those people are particularly vulnerable. And people with who already have mental health problems, those people have really suffered as well. So we've now got Mind's telling us, Mind in the UK is telling us that there's now, this year there's been 1 in 4 people have sought help for mental distress for the first time in their lives. The Royal College of Psychiatrists has told us that 2.2 million people have sought support this year. That's the highest ever. There's been a 19% increase in urgent care presentations for young people. So that's for things like unintentional, self-harm and overdose. And also, the Age UK, I was reading some figures yesterday because there was a new study. I mean, every day there's a study, isn't there, that's in the papers. And there was another study from UK and USA researchers who were talking about the extremely high levels of anxiety in the elderly population. Yeah. And I've seen Age UK talking about cognitive decline in the elderly. We've seen these dreadful, dreadful images of people in care homes and the way that they have been kept apart from their loved ones and kept apart from normal social contact, rise in anxiety, depression as age groups, and also with elderly people, and all of us, mental health and physical health are hugely connected, but you can't separate, particularly with the elderly. If you're shutting people in their houses, then the mobility declines, and there has been an unprecedented rise in mobility issues for elderly people, either new ones or exacerbated by being isolated. Those people have experienced a huge level of need that's rising as well. And the problem is that this isn't going away. As Carol was saying, Chris Witt is telling us that this isn't over.
Yeah.
So my concern is that with this going on, and with the arguments around resilience that were put forward last year, and I personally think that expired in about May or June last year, but we're still talking about the population is resilient, and particularly young people, which I find really insulting actually, because obviously young people are resilient, but they're resilient to terrible things like abuse as well, but that doesn't mean that we should subject them to that.
Yes.
So I think that this is going on, and we've also got a terrible economic reckoning coming, and we know that with economic recession we see rise in depression, we see rise in suicide. Suicides are preventable, so we should be doing something about this now if we know that's coming. This is really a crisis. It's a huge crisis. And you asked me what I see in my practice. Well, I literally can't see the people that are asking to see me. I work privately, and I've had triple the amount of inquiries since January of young people's parents seeking out psychological support because they can't access CAM services, or because the children don't quite meet the sky-high threshold for CAMs now. Yeah. So I'm seeing that, and all the young people who've been in my care, most of them, particularly in the winter lockdown, January through to March, when they were out of school, I saw deterioration for all those young people. So, and we're talking OCD, very common, as wouldn't surprise you in the current climate, and self-harm, accelerating, eating disorder, those problems. So yeah, I wish I had the optimism, I hope it's catching, that KAROL SIKORA has, but I hope that we can do something about this, and that the government will seriously take this on as an issue, as its next public health issue.
I think it's deeply troubling. Fear and loneliness, we've seen such an explosion of directly because of the government policies, and they are absolutely lethal to good mental health. And as we've seen in other areas, we talked earlier, I think David Paton talked about the fact that there's been no assessment of collateral damage. I think in some ways even worse that we never assessed the collateral damage on mental health of the kind of techniques that have been used, not just in this country, but worldwide around fear and loneliness. And I remember we organised as Recovery a meeting last October, just after we launched, with MPs, where we talked to them about some of the mental health issues that people were seeing. And when you quote the numbers, it's one thing, but when you actually illustrate some of the impact of those individual stories, and you talk about individual stories, it's hard to move an MP to tears, believe me. But we had MPs in tears at that meeting, and that's something that I hope the House of Commons remembers the next time they're looking at this legislation. Yeah. But the worst area, perhaps in many ways for me, the one that worries me the most, is what's happening with children and young people. And I know that's your area. How's it impacted them in particular?
And I think this society, I think we totally failed children this year. And it's been really distressing, actually. I use emotive terms, but it has been hugely distressing to see, because it was completely obvious to anybody who is either a parent or anyone who knows anything about children, that when you close schools, you're going to create an enormous crisis. Children become invisible, and that's so dangerous. Just in March, when the schools closed, I just finished doing an expert witness report for a child protection case. I do these things, quite regularly. And when you know about the extremely difficult circumstances in which many children live in this country, as soon as you hear that schools are going to be closed, you immediately think about those children and you think about what they're going to be subjected to. We had services that pretty much shut. So lots of the children I also work with, I work in neurodevelopmental clinics, have complex needs. So we had families with 2 or 3 children with neurodevelopmental issues like ADHD or autism and learning disabilities. And those families lost everything. They lost the special needs schools closed, respite care closed, social workers stopped doing home visits. I mean, in December this year, I was seeing families, and I was the first professional they clapped eyes on in the flesh since March. You know, and it is really upsetting to see, because it's been like watching a slow car crash, to be honest, because it was obvious what was going to happen. You know, and I think that what's so upsetting is it's still going on, because, you know, you've got this, you know, last week, you know, and Aspadana were doing a great job in publicising this, but we had over 11% of children out of school last week because of the track and trace system. We've had 93,000 children who are either in school 50% or less, or have been completely lost from the electoral roll since the pandemic started. 93,000 children. I mean, the impact upon their health, their life chances, their future earnings, the risk they have to, you know, in terms of criminal exploitation, sexual exploitation. I mean, where are these children? I mean, I find it completely astonishing, and we're still in a situation. I mean, that apparently from Monday we're no longer going to be kicking bubbles out of school. But I have no faith in this government that from September we're not going to see more school closures. I mean, I hope that we're not, because that should be the absolute priority. That children's services should be restored, that youth clubs, youth centres should open. We had reports from Wales last week about the number of children that had been taken into gangs and so on, so criminal exploitation because of, well, you know, because of the closing of youth clubs and so on. So I think if we were serious as a nation in addressing this and rectifying this and doing right by a generation that's been so harmed, we would restore normality for children. That's what we should be doing, absolutely. The children need to be living their lives uninterrupted. They need to be able to engage in the developmental work of being a 5-year-old or a 13-year-old or whatever it is, uninterrupted. And we know that they're not at risk, particularly of this virus, in any significant way. We know that they're not particular drivers of transmission, as far as I understand. So I don't understand why we're systematically harming the next generation.
Would you say then that the government and society have let children down?
Absolutely, absolutely. I think it's abusive, actually, what's happened. I know that's very strong, but I think it is abusive. Because if some of the things that have happened this year, if we were to think of a local authority looking at an individual family and saying, right, is this family able to meet these children's needs? Is this family serving these children's interests? They would say no. Okay, so this government, and as a society, in lots of institutions, schools and so on, they've implemented guidance or mandates which are actually harmful to children's development, to their emotional, cognitive and social well-being. So yes, I think it's abusive what's happened, and I think we really owe this generation, this younger generation, a massive focus to be able to sort this out.
And thinking about that massive focus, what would you do now to promote recovery? What could actually make things better?
I think the schools, I think there needs to be, the Department of Education needs to commit to the fact that schools will open and stay open, and that children will not be sent home. There needs to obviously be a focus on catch-up and so on, but I think more important, academically, I think more importantly, there are issues around children living normal lives. So I think lots of the measures in schools, the non-pharmaceutical interventions, the schools are open, and then there's a caveat that they've got to wear masks, they've got to kind of walk around one-way systems, they're not allowed to associate with somebody in the year above. I mean, these things just need to go. It's just insane. It needs to go so children can live uninterrupted lives. The other thing that needs to happen is the fear messaging. I think that the government's fear messaging, I mean, Claire and some of the other speakers were showing some of the propaganda that we've all been subjected to. But I think children have really borne the brunt of that, and some of it's been really nasty because it's actually been directed at young people and very blaming, and intentionally so. And not only has it affected children, but it's affected the adults around them. So like for lots of the families that I've worked with, I've seen practices within the family home which are really unhelpful to children's emotional well-being. So for example, children coming home and all their clothes being removed and washed in the washing machine straight away, and children in the shower. This sort of thing. I mean, and then you're trying to help a child manage germ phobia. We need to get this right, as in terms of the messaging for adults around children too, because they don't come on their own; they come in a system.
I think that's a really important point. And one of the things that I noticed is the totality of it. Everywhere you go now, you've got this very frightening messaging about a pandemic. You go on a train and you see posters and signs. You walk down the high street and now you see boarded up shops, restaurants gone out of business, offices to let. These are frightening things too, and signs of something being wrong. And brings me on to Luke Johnson. And I mean, is the situation as bad as it looks when we look around at business?
In some ways, it's been better than I had feared. So unemployment has not gone up nearly as much as I thought it would. Fewer companies have gone bust. I think a lot of it has been deferral of the pain. So, for example, there's been this moratorium in place between landlords and tenants since March last year, which has now been pushed out even further, well into next year. That isn't solving the problem, it's delaying it. And at some point, there will have to be a reckoning, and quite a lot more companies, unfortunately, will go broke, and I guess people in those businesses may lose their jobs. A great deal of the burden financially of the last 16 months has been taken on by our government. They've spent well over 400 billion supporting businesses through loans and grants and the furlough scheme and so forth. And if you introduce a universal lockdown, then I guess that's the only solution, unless you want, mass unemployment and civil unrest. Ultimately, those bills have to be paid, and our government will have to pay them. And I read yesterday, for example, that every 1% increase in interest rates will cost our government £21 billion a year in additional interest. These are all huge and complicated numbers, but the truth of the matter is, one of the genies that's come out of the bottle since lockdowns has been inflation. Many observers think it's temporary. I'm not so sure. Every single month now, in many countries, inflation is much higher than was expected, and if inflation persists, interest rates will go up. And we happen to be, sadly, in terms of our government debt, our gilts market, more exposed to higher interest rates than any other country comparable in the world. And so that could have very severe consequences. And at some point, the magic money tree that, curiously, not Jeremy Corbyn, but Boris Johnson has been very active with, will have to stop. I think one of the more depressing aspects of this entire disastrous period is that I believe the vast majority of all those giving the advice and taking the decisions are people, what I call in safe jobs with nice houses. And they are not in the firing line. Your last speaker was saying, it's the poor who always suffer the worst. And if society gets poorer, and probably in the medium term, we will all be relatively poorer because of what's happened, because, a monomaniac focus on one problem, one disease, inevitably draws away resources from others, then they will have worse health and well-being outcomes. Yeah. Poorer societies have shorter lives. And one of the more bizarre aspects of this period is that there's been an awful silence on the left. Those who are supposedly there believing in the underprivileged, who seem so keen on state intervention, they forget that actually you know, to a degree, the 1% have been winners out of this. Because of the inflation, asset prices have been going up, so their houses are worth more and their share portfolios are worth more, and the rich have got richer. But believe me, the poor have got poorer.
Yeah.
And it's the 10 million who had to go out to work every day, who are definitely, generally speaking, amongst the less well-off, who were at higher risk. And those, as I said, who are in safe jobs working from home with nice houses, you know, whenever I meet these people who say, actually, I've had quite a good lockdown, I have to walk away because I'm, you know, I'm otherwise going to be really abusive. And, you know, I think they are so unnaturally distant from the vast collateral harms that have been caused right across society. I mean, to a degree, you know, you could say the economic damage relative to the sort of health harms that you've heard earlier is secondary, and I completely understand that. But ultimately, you know, pessimistic and fearful societies decline. All history throughout has shown that. And if we lose our optimism, and if, for example, entrepreneurs don't start new businesses and people aren't willing to invest because they're fearful that the government will shut them down, then the medium to long term, there will be fewer jobs, there will be less tax to pay for an improved NHS, and we will all be worse off. And if you interfere with the workings of an incredibly complicated society, as governments have done over the last 16 months by separating people and closing down businesses and so forth and so on, you can expect all sorts of negative unintended consequences and collateral damage. And the problem is that we're comparing medium and longer term harms, health and economic, with apparent short-term, in inverted commas, benefits, i.e. possibly fewer hospitalizations and deaths, although even that's debatable. And as you've heard, and we all know, there has never been the sort of rigorous, important and detailed cost-benefit analysis done by this government, a proper assessment of what the harms and outcomes are of shutting down society. Yeah. And it's impossible not to think that the costs overall in health and economic and other ways will vastly outweigh any possible benefits.
I worry that you're absolutely right. I mean, for me, a lot of the businesses that have gone are small and medium-sized enterprises. I run one myself, and in the building we have the top floor of a building. On the floor down, the company's gone. The floor below that, the company's still nominally there, but nobody's seen them in a year. The floor below that was a very prestigious florist, which still exists as a name, but was taken over during the pandemic by a much bigger firm. I don't know how typical that is, but I suspect that's pretty typical. And what I'm seeing is lots of smaller, medium-sized enterprises, people where the entrepreneur is still in charge of the business, in some ways the lifeblood of the economy, the healthy up-and-coming businesses that are dynamic, that are creating choice for consumers, that are putting forward new ideas. And those are the ones that have been hit. And that really worries me, because what I see at the same time is a lot of giant mega corporations and big digital giants hoovering up all the good business that's out there. The implications for consumer choice and for the dynamism of this country and around the world going forward seem to me to be quite grave. I mean, what do you think about that?
I think there's a lot of truth in it. I think big companies have benefited in many cases from the lockdowns because they've eliminated competition, which have not been able to keep going. I think, as you say, an awful lot of small and medium-sized enterprises have closed. And certainly, you know, I know personally a number of entrepreneurs who've just given up. They're knackered and they're depressed and they just can't see a way forward. However, we can't end on too negative a note. And never bet against entrepreneurs. You know, they will revive, they will reinvent. You're right, they are the source of most innovation that leads to more dynamic and healthy economies. And, you know, I'm forever astonished at how entrepreneurs can get battered and then they will come back fighting. And I've seen in the cases of a number of smaller businesses that have somehow coped and reinvented themselves, and they will reinvent themselves again when society fully opens up. And so I would end on a more encouraging note, which is I think that we cannot write off the inventiveness, the energy, and the resourcefulness of the entrepreneurial mindset that I think we will need to recover our optimism and create new enterprises and jobs that will revive the economy.
Before you do end, because I think that is a very powerful message and one that certainly is welcome to me, just to play the devil's advocate for a moment, the lockdown argument is this had to happen. If we have this kind of situation, there will be collateral damage. The most important thing was the health of the country. Whatever it took to safeguard health was necessary. And if business is to recover, we had to lock down because lockdowns promote recovery more swiftly. How do you respond to that?
Well, what I would say is that at no point that I've seen has the government used the traditional health economics measure of things like quality adjusted life years to say, okay, what is the collateral damage to children, to cancer treatments and to other aspects of life? And do we, as KAROL pointed out, who's worked for the NHS for 40 years, does society run to help support the NHS, or is it vice versa? And well-being is a 360-degree thing. We have developed an obsessive-compulsive focus on a single illness, which has accounted for about 15% of all deaths since it started last year. What about the 85% of other deaths? And what about the other aspects of living? You know, let's make the most of life while we are here as well. And we all know that work and being productive is good for health. And if you prevent people from working as well as destroy relationships, which I think is also at the heart of human happiness by keeping people isolated, then it can't be right. And I think that, we are here in this room, a small minority. The vast majority of the population apparently still think lockdowns are effective. They think that the benefits outweigh the harms, and that, if needs be, we just have to lock down again and again and again. How long is it before we decide that actually, perpetual lockdowns in themselves prove they don't work? Yeah. And we get this disease in proportion? That's all we have to do, just get this disease in proportion relative to all the other aspects of life. The truth of the matter is, the really, really, really effective policy of the government, outstandingly effective, world class, they've frightened us senseless. Their propaganda has been the most effective in the world, which is why I've seen research that says we've been the most frightened. Yeah. And it's the fear that we have to remove. And once the fear goes, then the optimism and belief in life can return, and we can start to properly recover. But unfortunately, with every new variant or whatever it is, everyone gets overly scared again. And it just keeps going, and it has to stop.
I couldn't agree more with that. That's a message I 100% agree with. So that's the questions that I have for today for the panel. But I'd like to invite back some of our speakers from earlier in the day, Claire Craig and Professor Paton.
They're signaling to you.
Oh, sorry. Oh, sorry. Sorry, David.
You've got to be in the room. Zoom doesn't work.
I apologise. Following on from that, David, what do you see as the economic impacts of this from your side, from the academic perspective?
Yeah, I think Luke's made some really good points on the consequences. I think one point we have to be careful about. People often say that the problem is with the pandemic itself. That's what causes the economic effects, not the lockdowns. You would have the economic hits. And there's some truth to that, in that we have the pandemic, economic activity goes down, people don't go to shops and spend money in pubs and hospitality and so on. But of course, lockdowns have an extra effect. So when a government tells businesses that they have to shut down, that's a lockdown effect. When businesses are hit for lower demand, that may be a pandemic effect. So although that argument has some truth, I think there's no doubt lockdowns have a very significant economic effect. And you can see that in some of the data. So UK, we had a hit to GDP of 9.8%, just about 10% in 2020. You look at other countries, so countries like Norway, which had a very limited pandemic effect, had a much lower hit. But the EU, across the EU, about 6.1%. But then Sweden, which didn't lock down, they had a hit of 2.8%, much, much lower. So right in the headline figures, you can see, well, yeah, there is a difference. Sweden had just as big a pandemic effect as we did, but didn't lock down. And you can see those impacts. So I think the other point, just to emphasise what Luke said, lots of the economic impacts have been masked by the furlough, by the government support. And I know many small businesses have slipped through that support, but the support there has limited the effects we've been seeing. So we've had some really, terrible economic effects already, but the much, the longer term impact on public finances, and quite rightly, as Luke said, with inflation going up, the risk is interest rates go up, which then really puts our finances at risk. Who's going to pay for it? Our young people. Yeah. So I'm so pleased that Zenobia highlighted the devastating impact they've had on they've been put through by deliberate public policy. But unfortunately, that's not going to end because they're the ones who are going to shoulder much of the economic consequences in the future.
And looking at that, what do you think of the short-term and long-term economic impacts we're going to see? Particularly the long-term on our children, perhaps.
Well, yeah. It does depend how things work out, and whether we have an immediate recession, much will depend on if inflation is sustained and interest rates have to go up, then we will be at risk of quite serious short-term consequences. And we know that when you have economic consequences, that does have implications not just for the economy, but for health, for money you have to spend on health and education, but also on direct health impacts for people who are, businesses are lost, on suicides, on depression, and so on. So, there's a whole range of things. And I think it's probably fair that actually the big costs of lockdowns are probably more in the psychological, the emotional, the social hits to everyday activity, the fact, small things that people can't sing in their choirs, or you couldn't, an elderly person, it was a criminal offence to invite somebody into your home to have a cup of coffee, not just for a couple of weeks, which people might have understood, but for months on end. That's where the really serious costs are. But we can't avoid, we know we've already lost businesses and retail chains, pubs have gone bankrupt, and that's not going to go away. And as a furlough scheme is, we move away from that, move away from business support, which will have to happen in the end, even though we seem to still be in this continual cycle of talk, at least, of never-ending lockdowns. At some point, that's got to come to an end, and that's when the reckoning will come.
And do you think the Chancellor and the government are doing the right things? What do you think they should be doing now with a supposed Freedom Day around the corner? This is the opportunity to put some of this right, I would have thought.
Yeah. What you need is a bit more confidence. So confidence in the vaccination programme. That means that even if you thought that lockdowns were effective, and as I've explained, the data isn't really there for that, but if you believe lockdowns are effective and necessary, that should no longer be the case given the vaccination programme of the vulnerable. So have a bit more confidence and be absolutely clear and say we are not going to lock down ever again. We're going to go down a different strategy of information, advice, and more standard ways that people approach health crises to give businesses the confidence that they can invest in the future without being under this constant threat that half their staff will be out because of being pinged by the NHS Test and Trace app, but longer term, that at any point the government could tell their businesses to shut down again. We've got to have that change and confidence in a new way of, in a new approach to tackling the virus.
That's, something I think we can all agree with. And now, having given a sneak preview, apologies, David, for that, of the fact that we're coming up to questions from the audience, it's time for everybody to put their questions to the panel, and we're joined by some of our earlier speakers. Nick Hudson is available again for questions, and Claire Craig has joined the panel. Thank